here's a bit of an update on Gary. It was not a good morning. We had a vet appointment for 2:15, but I came in this morning and saw that he was out. And then when I went to go touch him, he dragged himself back into his enclosure, or into his kennel. So here's the footage of what it looked like when he was dragging himself around, coming out of the kennel. So it was heartbreaking to see this. So we're gonna see how he is. I called the vet. So we're at the vet's office right now. There's Gary, just, you can hear him. He's growling away, just not happy. So we're gonna see what's going on, because this is not good. He's not happy. It's okay, Gary. We're gonna figure out what's going on. So we just had an initial look at Gary. The vet's not sure if the walking is because of the gabapentin we gave him, because that can really throw them off. But usually that'd be all the legs, not just the back legs. So we're gonna sedate him in a minute, which is gonna be great for you, Gary. And then the first step is gonna be an X-ray. And I forgot my gloves at the greenhouse, but I bought these ones at the gas station on the way in here. All right, so Dr. Allmark is now in, checking him out.
So his pupils are responding nicely to the light, nice and symmetrical. Back of the eyes look great from afar. Seems to be able to see pretty well. His breathing is pretty regular. Just get his breathing right.
What's the towel for?
Towel, my friend, is just to hide that little face of his, so I can get access to that back end muscle to give him his sedative. It's best just to sedate this little guy, and then we can do the diagnostics the best that we can and find out what's going on. So I'm just going to go into this back right thing.
Oh.
Just hold him down lightly. Good boy, Gary.
You can chew on it. Yeah, they work. So we think Gary is out. He is out. Hey, buddy. Yeah, he's out. I'm gonna put him without the gloves for the first time. Hey. There we go.
On there.
And the lube is just because he's not going to blink very much right now.
Exactly. Yeah, his eyes are,
Yeah.
are pretty out. We'll put that muzzle on, and then we'll put these little earplugs in his ears. It just stops any noise stimulation.
Why do their eyes stay open when they're sedated?
It's, interesting question, man. Their pupils tend to stay central because of the type of drugs that we use.
Yeah.
So that just makes them at risk of any corneal kind of lesions while their eyes are open wide like that and not blinking. So we're going to get him hooked up to ECG and pulse ox so we can monitor that heart rate and everything while we're doing the x-rays for him right now. We're going to just drag him out here so that neck's nice and straight. And then we'll take him through. Okay.
Great. He's a little chubby. What are you hooking up down there?
These are electrode clips that are going to read an ECG for us.
Oh. Interesting. So that's how you get a urine sample.
It'll give us a bit of information about his kidneys, if there's any infection there. His penis is just there, so it comes out quite nicely. But it's good to know that his bladder's nice and soft.
Yeah.
He's not blocked in that sense.
She's making him pee. Gross. I was wondering what a cat looks like when it's getting an x-ray. This is it. Like, everything looks normal in the spine for now, so far. To me, anyways. I'm not a vet.
This is a big fat pad, Mike.
We're working on that. We're getting him a wheel soon.
Kidneys. There's no overtly crazy gas pattern that we worry about when we've got an obstruction. And then if we look at the spinal vertebrae here, we're looking at kind of the spaces between each vertebrae to see if there's any spondylosis, arthritis, or disc changes. A little bit of a hump going on here. This is soft tissue, muscle area. Is that something? I'll have a feel of that when he's back on his side. Huge bladder still, even though we've expressed it. Beautiful hips.
Just noticed that bald patch yesterday, so I didn't know if he's...
Not out of stuff?
Is that linked to swelling?
So in the x-ray, it showed that Gary had a chip. So this is what you're scanning for right now is the chip?
Yeah.
I didn't know he had a chip.
Perfect, I got that number for you.
So any ideas now, after looking at the x-rays and everything, what do we...
So, everything on the x-rays so far looks pretty unremarkable. There's no obvious signs of arthritis or obstructions within the abdomen. We do note this kind of excessive licking area here. Is that,
That's just yesterday.
yeah, is that him telling us something was in pain?
Yeah.
You know, and he has twisted a muscle or something soft tissue there. We can't see. There looked like there was a little lump over his spinal area here, but I can't isolate any significant mass. It just feels like fatty tissue when we feel over that area. I'm just going to check out his teeth and his gums right now, and then we'll get him on some fluids, some oxygen, and probably because nothing is obvious on these x-rays, we'll run a blood panel and just see what we're missing there.
Jealous that she gets to carry Gary, and I've never carried Gary. So I can't watch this part, but I'll record it. And now that we're recording, so they can hear from a professional, what are the fluids for?
We are trying to replace any fluid loss that he may have had over the last kind of 24, 48 hours with not eating or drinking.
Now, just to give a full workup, they're taking blood as well because we're not really sure what's going on yet. All right, so what are we doing here?
We're running a urinalysis. So this is going to test his urine, make sure there's no UTI going on. It'll also check his hydration status, make sure his kidneys are working normally, and can concentrate his urine normally.
I didn't know this. They actually test the blood here, so that's why we love Townline, because they're an amazing place with everything you need. So what all can you test for with these?
Yeah, so we've got all in-house analyzers. So this one is our chemistry screen. So right now we're testing his liver, his kidney function. We're also testing his just overall internal organs, his electrolytes. It'll check for all of that. Then this one's our CBC machine, so that tests our red blood cell levels, our white blood cell levels. We'll see if there's any infection, any anemia, anything like that. And then this one's our urinalysis machine, so it's gonna detect if there's any bacteria.
And then how long will it take to get results from that?
Less than 10 minutes.
Oh, wow. Okay, so a lot better than sending it off to a lab. And okay, cool.
The lab is a little bit more sensitive,
Yeah.
but for our purposes, when we have a patient that needs
Something quick.
it's
Okay.
perfect.
Awesome. All right, so Gary is not dead, but there's a blanket on him because his temperature was going down. And now he looks all cute under a blanket. Oh, and he's got socks on. He's socks on still?
Yep.
He's got socks on. Look at, he's got Gary socks. Are those just people socks?
Yep.
Oh, okay. So now we're doing an ultrasound. What kind of things are we looking for in there?
Just checking the integrity of all the abdominal organs, kidneys, liver. This huge bladder that Gary's got with a bit of sediment in, but just making sure there's no bladder stones.
Now, you've mentioned the size of the bladder a few times. Is this something we should be concerned about, or is this like a...
It's nice and soft and flaccid and easy to express, so... And the urinalysis that we just ran was clear, which is great.
All right, so now for the first time, we're going to get an official weight on Gary since he's out cold.
Okay, so a bit lower than we thought, 18.
Oh, so he's not as heavy as you thought he was? Can you say that louder for the camera?
No comment.
So what was it, 18.1?
18.1
18.1, okay, awesome. So really quickly, in 30 seconds or less, can you just say what we're doing here? The reversal, and then what was the...
Yeah, so we've just given him a long-acting antibiotic now, and an anti-inflammatory just as a one-off to see whether that will help in the way that Gary has suspected to be feeling. We're just going to give him as the reversal now. He is starting to get a blink back,
Okay.
so we just got to be careful. We'll get the lid going, so 0.22,
Yep.
just the half.
And then how long should he be like groggy and out of it for, even with reversal? Like it'll be another day or so before he's back to his normal self, or?
Yeah, just let that anesthetic get out of his system in the next day, and he should be pretty feisty again.
And then we're thinking that
Within half an hour.
walking this morning was because of the gabapentin just being out of it?
Yeah, hopeful. Yeah,
Okay.
hopeful that ataxia was just due to a little bit of a side effect of the gabapentin tried to be given.
So, where would we go from here, like with him, the loss of appetite and lethargic and that? Like, if he doesn't perk back up within the next, how long should we be thinking, or what? I mean, I don't know what else we could do at this point. We've done blood and X-rays and
golden question.
ultrasound.
We're going to send those X-rays off to the radiologist to get an interpretation on them. Make sure we're not missing anything that we've not noted today, and then if he appears really, really good in the next 24 hours after the injections that we've given him, then maybe pain was part of his problem, and we'll give you the oral form of the pain relief to continue with at home for the next few days, just in case he did have a soft tissue injury and he's tweaked his back, his back end, and it was because of that pain. He just felt a bit vulnerable, that he was trying to hide himself away until that pain was resolved.
All right, so we're all packed up. Gary's in the back here. We're gonna head out. So it's one of those frustrating things. Like, we did all the tests and everything. Obviously something's wrong, but we don't quite know what yet. So we'll see what happens with the pain meds. Maybe he pulled something or did something which is acting weird until the pain goes away. They're going to send the X-rays off to an actual tech to get a better look at them. But I mean, it's just kind of a wait and see what happens over the next few days with Gary. But hopefully he does okay. And that was a $1,600 visit. So, but they did a lot. We appreciate them. They did everything they could, got us in. So it's just one of those things that we just got to figure out what's actually going on. So we'll keep you guys posted in the next few days of how he's doing. Thanks for watching.